It's better when I start with workflow of the robotic surgery.
Sure.
Before the surgery, we take a CT of the patient. The area of the CT of the surgical area, and we have a software on my PC, and on my PC I can plan the surgery before the surgery, and I can plan the position of the screws, the size of the screws, the length, diameter, and all of things I can plan before the surgery.
So
with my software on my PC.
So we can say, let me paraphrase for the viewers as well. So you can do somehow tryout of the operation, right?
Exactly.
Okay.
I do the surgery before the surgery.
Okay.
On my PC. And after that, I transfer my planning to the robotic workstation. Robotic workstation is a device in operation room, and workstation is connected with robotic arm. Robotic arm is connected with the robotic surgical table. And during the surgery, robotic arm approach to the spine according with my planning before the surgery. Great. And this robotic arm has a cannula, and after the approaching of the robotic arm is completed, I put the screw through this cannula, and that's why I can put the screw in the right position like I planned before the surgery. Otherwise, in the other technique, freehand technique, we cannot plan anything, and we need to feel the bone tissue during the surgery. It's very important to be very experienced in the manual surgery. Therefore, even you are an experienced surgeon, you can put the screw in wrong position during the surgery.
Especially because we are talking about tens of millimeters, probably. Right. It's not like you can be wrong with a few centimeters even. It's just like slightly different makes a big difference, right?
Yes. And what happens if the screw is in the wrong position? Nearby of the bone tissue, there is nerve tissue, nerve roots, spine, and other important organs, like in thoracic area, for example, very big vessels, aorta, vena cava, lungs, and other important organs.
Yes.
Therefore, if I put the screw in wrong position, they can be a cause of catastrophe.
Okay, and some kind of complication I can imagine as well.
Yeah.
What kind of complication can happen after this kind of wrong placement of the screw?
If the screw touches to the nerve, or if we injury a nerve root, the patient can have weakness on the legs after the surgery. Or if we target a vessel during the surgery, we can experience a big bleeding during the surgery, and the result can be a catastrophe.
Yes, sorry. Is it possible, because I want to go to the core, because there is some group of the complications which are causing the pain after the surgery. You said the weakness of the legs, but for example, if you will put it in this displacement happening, is it possible that the patient feels like chronic pain, for example?
Right. Some displacements doesn't hurt the nerve root, and doesn't cause a weakness on the leg, but the screw can touch the nerve root, and this touching may be a reason for a chronic pain.
So what patient can do in this kind of situation? Is revision necessary?
Mostly. Mostly in this situation, the revision surgery, the removing of this displaced screw, and put a new screw, it's
necessary
sometimes.
So what you do here is you are putting aside of the things we just mentioned, because as you said, you plan the operation with the robotic assistance, you are making it perfectly. So this kind of things are not happening, right?
You're right.
So
these complications the possibility of these complications are nearby 0%.